What causes tinnitus? Temp relief or long-term relief? Millions of people experience tinnitus, a condition that is characterized by the impression of sound when no external stimuli are present. The sounds heard can vary in intensity and frequency and can sound like ringing, buzzing, hissing, or roaring. While tinnitus itself is not an illness, it is frequently a symptom of one. Please be aware that everything discussed in this video is unbiased, verified with facts, and approved by a licensed healthcare specialist before we proceed. The purpose of this video is to examine the numerous tinnitus causes and throw light on the elements that lead to the condition's emergence. In light of that, let's start by talking about the causes of tinnitus and some methods for treating it. Exposure to loud noise. Prolonged exposure to loud noises is one of the main factors contributing to tinnitus. The delicate hair cells within cochlea, the auditory component of the inner ear, can become damaged by activities like going to concerts, working in noisy environments, or using headphones at high volumes. Tinnitus is a result of this damage, which alters one's ability to hear. If you want to avoid this kind of harm, you should use hearing protection in noisy settings. Age-related hearing loss. Hearing loss can naturally occur as people age as a result of damage to or degeneration of the sensory cells in the inner ear. Proboscisis and age-related hearing loss is a common risk factor for tinnitus onset. Tinnitus can develop from the brain producing phantom noises as a means of compensating for the lack of auditory information caused by damaged cells. Earwax blockage. The ear canal can get blocked by earwax accumulation, which can affect proper hearing. Tinnitus may become present as a result of this obstruction. The symptoms of tinnitus related to earwax impaction can be reduced by removing excess earwax, which is frequently done by a healthcare expert. Ear and sinus infections. The auditory system's regular operation may be interfered with by infections in the ear or sinuses that result in swelling and fluid buildup. Tinnitus can develop in a favorable setting if there is fluid from an infection present. In such circumstances, tinnitus symptoms may be lessened by treating the underlying infection and lowering inflammation. Ototoxic medications. It has been determined that specific drugs may act as tinnitus triggers. Numerous antibiotics, cancer medications, diuretics, and non-steroidal anti-inflammatory medicines or NSAIDs are among them. These drugs can have a deleterious effect on the auditory system, causing tinnitus as a side effect, albeit the exact mechanisms are not entirely known. Head and neck injuries. The auditory system can be harmed by traumatic head or neck traumas, which can result in tinnitus. The development of tinnitus may be influenced by direct damage to the ear, fractures of the temporal bone, or accidents that cause whiplash. The impact on hearing and tinnitus symptoms must be reduced in such situations by prompt medical evaluation and treatment. Temporomandibular joint or TMJ disorders. Tinnitus may develop as a result of issues with the temporomandibular joint, which joins the jawbone to the skull. The auditory system is among the nearby structures that might be impacted by TMJ misalignment, excessive strain, or dysfunction. Tinnitus can be treated in conjunction with TMJ issues by using the proper therapies such as dental appliances or physical therapy. High blood pressure and cardiovascular conditions. A number of cardiovascular diseases, including hypertension or high blood pressure and atherosclerosis, narrowing of the arteries, can impair blood flow throughout the body, which includes the auditory system. Tinnitus may be exacerbated by poor blood flow to the inner ear. Tinnitus symptoms might be reduced by controlling and treating certain underlying cardiovascular problems. Stress and anxiety. Though they don't cause tinnitus, stress and worry can make it more noticeable and have a negative influence on a person's quality of life. More tinnitus awareness might cause more distress and irritation. Stress and anxiety can also make tinnitus more noticeable. In addition, The physiological modifications brought on by anxiety and stress can exacerbate tinnitus symptoms, making it more uncomfortable. The aim of treatment for tinnitus can change based on the patient and the underlying cause of the illness. In certain situations, the goal may be to alleviate the symptoms temporarily, whilst in others, the objective may be to obtain long-term alleviation or perhaps a cure. Tinnitus acute symptoms are the focus of temporary alleviation techniques, which also aim to offer short-term comfort. This may consist of: Number 1. Sound therapy. External sounds such as white noise, natural sounds, or music can be used to mask or distract from tinnitus sounds. This can be accomplished by using wearable sound-generating gadgets or environmental sound machines. Number 2. Medications. Certain medications such as antidepressants or anti-anxiety medications may be recommended to assist control the emotional and psychological distress caused by tinnitus. These drugs can provide brief relief by alleviating anxiety or depression symptoms. Number 3. Stress management techniques. Learning relaxation techniques such as a deep breathing, meditation, or yoga can help reduce stress and anxiety levels, which may, in turn, alleviate the perception of tinnitus. Number 4. Avoiding triggers. Identifying and avoiding potential triggers that worsen tinnitus, such as loud noises, caffeine, or certain medications, can provide temporary relief by minimizing the intensity or frequency of tinnitus episodes. On the other hand, long-term relief or even a cure for tinnitus focuses on addressing the underlying cause or finding ways to manage the condition effectively. This may involve: Number 1. Treating underlying medical conditions. Treatment of the underlying problem may provide long-term relief from tinnitus if it is a symptom of an underlying medical condition, such as a sinus infection or temporomandibular joint (TMJ) disorder. 2. Hearing aids or cochlear implants. The use of hearing aids or cochlear implants can assist enhance general hearing and lessen the prominence of tinnitus sounds in situations where tinnitus is accompanied by hearing loss. Number 3. Tinnitus retraining therapy or TRT. TRT is a form of therapy that combines counseling and sound therapy. It aims to retrain the brain's response to tinnitus and reduce the perception of its sounds over time. TRT is a long-term approach that can lead to significant improvement for some individuals. 4. Cognitive behavioral therapy, CBT. CBT is a therapeutic approach that helps individuals change negative thoughts and behaviors related to tinnitus. It can help reduce the emotional distress associated with tinnitus and improve coping mechanisms, leading to long-term relief. It's crucial to remember that treatment success varies based on a variety of circumstances, such as the underlying cause of tinnitus and the intensity of symptoms. While some people might just need short-term treatment, others could need a variety of strategies to attain long-term relief. A healthcare specialist such as an otolaryngologist or an audiologist should be consulted in order to establish the best course of treatment for each patient's unique situation. There are several probable causes and contributing factors for the complex illness known as tinnitus. Tinnitus is frequently linked to underlying problems with the auditory system or other physiological conditions, despite the fact that the precise mechanism of tinnitus formation is not entirely understood. Effective management and therapy of tinnitus depend on determining and addressing the underlying cause of the condition. People who have tinnitus should consult a doctor for help, especially an audiologist or an otolaryngologist who specializes in the diagnosis and treatment of hearing-related problems. These medical specialists can carry out a thorough evaluation, which may include a thorough medical history, a physical examination, and sometimes further testing to identify the underlying cause of tinnitus and create a suitable treatment strategy. Even though there may not always be a treatment for tinnitus, there are a number of management techniques that can help reduce symptoms and enhance quality of life. Depending on the underlying cause and the particular situations, these strategies can involve sound therapy, counseling, stress management techniques, hearing aids, or medication. Promoting preventive interventions depends on raising public knowledge of the probable causes of tinnitus. Tinnitus development can be lowered by safeguarding hearing, by limiting exposure to loud noises, wearing hearing protection in noisy situations, and getting immediate medical assistance for ear infections or injuries. To provide more specialized therapies and interventions, additional studies and breakthroughs in our understanding of tinnitus are required. We may try to enhance the lives of those who are afflicted with tinnitus and work toward improved treatment techniques and potential future therapies by addressing the causes and risk factors connected with these illness. As always, we care about your health. If you enjoyed watching Vital Health TV and learned something from this video, please hit the like button and subscribe to our channel for more videos like this. Thanks for watching!